Hello. This is Making Sense of History, the podcast where we find out about the present by running the clock back to see where it all started. I'm Nick Eckstein from the History Department at the University of Sydney, talking to you today from Wurundjeri land. In the following conversation, my guest and I are going to talk about how historians can help medical experts to talk about pandemics, why we need more historians in the media talking about the present in general, and how people who aren't professional historians can still do history in their own lives. To do today's episode, I needed to find someone who had majored in English literature, studied pharmacology, was a professional writer, worked in radio broadcasting, did a PhD in history, taught in universities, worked in an archive, and went on to work in museums and became a radio star along the way. Luckily, I found him. Dr. Peter Hobbins is current acting head of content at the Australian National Maritime Museum in Sydney, where he's also head of knowledge. Prior to that, Peter was principal historian with Artefact Heritage Services, and he was Senior Communications Officer for the National Archives of Australia from 2010 until 2019. Peter occupied several positions at Sydney University, including that of Senior Research Fellow in the Department of History, which is where I got to know him. Peter is a prolific academic author. In addition to around 40 peer-reviewed articles and book chapters, he's written 2 books. The first is titled Stories from the Sandstone, Quarantine Inscriptions from Australia's Immigrant Past, published in 2016. That book won him the 2017 New South Wales Premier's History Award. His second book was Venomous Encounters, Snakes, Medicine and Scientific Medicine in Colonial Australia, published in 2017. And if you find that list of achievements and pursuits exhausting to listen to, you should try working with this bloke. I say that with the utmost collegial affection, Peter. Thanks so much for agreeing to talk to me on Making Sense of History today.
Always a delight to have a conversation with you, Nick.
Today's podcast might seem counterintuitive at first glance. I want to talk to you, among other things, about pandemics, epidemics, and especially COVID. And I really wanted to talk to you because during the COVID crisis, you did over 70 interviews across radio, television, and print journalism. But you're not a medical doctor, are you?
That's right. I do sometimes say I've been doctored enough, but my PhD was actually in history, not a Bachelor of Medicine and Bachelor of Surgery, which is what you would normally have as a medical doctor.
That's essentially the reason I wanted to talk to you, to ask what a historian can offer that a medical expert might not be able to tell us first. I think people listening need a bit of background about you. Did you do history at university?
No, I didn't. I'd studied history at high school, and then I stopped studying it when I went to university because I loved it so much, and I didn't feel I wanted to suck the joy out of it.
Later on in your undergraduate degree, you combined arts and science.
So I majored in English literature, and really I've been a writer my entire professional career, but I also studied pharmacology, which is the science of how drugs work. And I ended up going on to do honours in that subject as well. So part of my project in my honours year, way back in 1994, was looking at 2 different kinds of snake venom in a laboratory. So I was effectively a vivisector, to use a 19th century term. That saw me moving from Melbourne to Sydney in 1995 for my first real job. And when I got here, I then moved on and did a bit of volunteer work on a radio program as well at 2SER. And that was fun for a couple of years. I learned to produce radio programs, to script them and to speak comfortably, one hopes, in front of a microphone. But it also confirmed to me after a couple of years that my heart wasn't in it and I really didn't want to move into the mainstream media.
But during that time, you actually had quite a diverse audience, I think, didn't you?
When I was working as a medical writer, I was primarily writing for medical doctors, usually summarising technical literature and current medical opinion. But also I wrote a wide range of materials that included booklets for children with obsessive compulsive disorder. So it was certainly a very varied career, but primarily it was designed to educate people about health conditions and drug treatments.
Around 40, you've told me in conversations, you came back to university and then you chose history.
Had a few goes at coming back to postgraduate study. Not all of them were successful, but in the end I completed a Master of Medical Humanities, which was a novel and short-lived course, but it allowed me to sneak back into university, do some philosophy and ethics courses, and then start picking up a couple of history units.
When I met you, you were working on the Sydney University Quarantine Station project. Can you tell us a little bit about the Sydney Quarantine Station, particularly for non-Australian listeners, what that is or was, and what you and the team studying it were doing there at the time.
Quarantine is the practice of separating people or animals who you think may be carrying an infectious disease from people you think are healthy. And fairly early in the establishment of the colony of New South Wales in the early 19th century, when you could only arrive by boat, a quarantine station was established at North Head, right at the entrance to Sydney Harbour. The project we were working on looked at the carvings that had been left in the soft sandstone at that place by people who'd been detained in quarantine from 1835 right through until 1984 when the station finally closed. So it was a great project that combined history and archaeology. And I think what really brought it together was the strong sense of place out there and an isolated location in a beautiful landscape at the entrance to Sydney Harbour.
Archaeologists investigate the past in quite different ways from historians. What things did you learn from the quarantine project?
Much as we as historians like to believe that textual sources are the best way to access the past, in fact, there are many things that are not written down, or in fact, even that the things that are written down aren't borne out when you go to ground. What archaeologists call ground truthing, where you actually go and check what really happened where things were occurring. It was great to have to scale back the conceit of historians a little bit and actually check our facts in place.
Did you take much convincing about how important direct, concrete experience was compared to the testimony contained in archival documents?
I'd actually been a little bit dubious going into the project about the importance of being on the land. I guess these days we might call it being on country, because I felt that you didn't really need that to understand the past. But I completely changed my attitude by spending time out at the quarantine station and understanding how that environment shaped the experience of new arrivals in this country, whether they were sick or not, how the experience of death and having burials in the cemeteries there might have shaped experiences, but also feeling the cadences of the seasons, of the mood of the airs and the waters around us. Yes, it certainly did have a potentially dark history, particularly if you'd been suffering from disease or suffering the loss of loved ones. But it was also a beautiful place, and the thought of coming into the entrance of Sydney Harbour on a boat that had probably spent between 4 and 6 months at sea, coming ashore in this lush bushland with supplies and fresh water coming in from Sydney, it could actually have been quite a joyous place. And certainly for people getting off a boat, that must have been a wonderful feeling no matter whether or not they were ill.
So that's what you were doing around the time I met you. If we jump to 2020, lots of people in the media start asking you to talk about COVID. But arguably, you're not what they are used to. I'll explain what I mean by that. In Australia, Dr. Norman Swan is a household name. He's a medical physician, a famous ABC journalist and broadcaster, who after 2020 achieved an even higher profile by co-hosting with his colleague Tegan Taylor a daily podcast called Coronacast that helped millions of Australians negotiate the pandemic. And you're not that kind of doctor, but you do have an unusually diverse portfolio: English literature degree, pharmacology degree, history PhD, professional writer in the private sector, university teacher, and you have hands-on broadcasting experience. Did the media know what they were getting when they invited you?
I think one of the things you realise the more you interact with the media is that often you're just expected to be an expert, full stop. You're a talking head. You're there simply to fill airspace and to answer questions that are on people's lips. And one of the real challenges in dealing with the media is drawing boundaries around what you feel confident and safe saying and what you don't. So as you said, Nick, unlike Norman Swan, it wasn't my job to monitor the health crisis. I had a full-time job as a heritage consultant at the time. What I did have was a long and deep historical perspective on epidemics, on disease, on treatments, and on quarantine, and that I could apply some of those stories from the past to help us understand perhaps what we were going through at the time as well.
And that brings us to the question I really wanted to ask you, Peter, the whole point of this conversation. Is it important to involve historians in public discussions about crises in the present? More specifically, does a historian contribute something special to the public discussion of a crisis like the COVID pandemic? Can historians tell us things that medical doctors can't?
I think what historians do best is put complex historical developments into a wider context and then draw a few through lines through them as well. So we can actually provide a narrative that joins diverse experiences and social and cultural and technical factors into a form that people can understand and perhaps take a message from, perhaps even take some hope from as well.
I imagine that one of the biggest challenges of talking to the media about COVID is people's expectation that we can learn lessons from the past, because history repeats itself, that we can use the past to fix the present and the future. Academic historians don't really believe that because, to put it simply, reality is simply too complex. Mark Twain probably put it best. He said that history never repeats itself, but often it rhymes. To give a specific example of what he meant, the so-called Spanish flu pandemic of 1918 to 1920 happened in a world that was fundamentally different from ours, so just comparing the Spanish flu with COVID is going to be a clunky exercise and probably rather misleading. But there are things to compare. If, as a historian, you're inclined not to treat the Spanish flu purely as a medical phenomenon.
I agree with you about that sense of echoes or resonances. And certainly back in 2020, perhaps for the first time in my professional career, I really felt that I was experiencing not quite a sense of déjà vu, but an uncanny familiarity with what was going on around me. And I thought, wow, this is so similar to what I've studied in the past when I looked back to that Spanish flu or pneumonic influenza pandemic that took off in 1918 and wrapped up around 1920. An epidemiologist, for instance, who's a medical scientist who studies patterns of behaviour and human responses to them, they would study that Spanish flu pandemic in a very particular way, usually around specifics of human behaviour and their interactions with each other and what did or didn't work in terms of preventing disease. As a medical historian by training, I was quite aware that Spanish flu wasn't just a medical phenomenon. It wasn't about a virus jumping from person to person and then individuals either becoming ill or not. It was also about a massive historical moment in time. It came right at the end of the First World War. It came on the tail of the huge dislocations and trauma and tragedy that accompanied people moving around the world, massive loss of life, massive change in our social makeup, particularly the role of women in society, particularly in the Australian context of late 1918 and 1919 when the war was over and the soldiers and the nurses were coming home.
The way you're talking emphasises the difference between the way an epidemiologist and a historian work, where the principal focus of a medical researcher is the pathogen itself. For you, society is the subject. So for a historian, the context for a historical study of a pandemic or epidemic is not the disease, it's the society.
We're now looking at how a society completely recalibrates itself in the aftermath of a major conflict. And so you have all of that going on, all those dislocations, all the women giving up their work so that men could come back to the jobs that they'd been promised, all of the families suffering the grief of losing one or more family members. And into the middle of that, you throw a pandemic, the likes of which we hadn't really seen again until COVID hit us a few years ago.
As you said, the Spanish flu can't really be separated from those other huge movements. In fact, if you exclude the introduction of women into the workforce, the mass repatriation of soldiers, and all the other phenomena associated with post-war reconstruction, you really can't understand the Spanish flu at all. And a historian is very well equipped to explain how a pandemic isn't just a medical phenomenon, but that it's also a historical phenomenon. But this is not an argument about territory. It's not saying that one way of looking at the past is superior to another. It's more an argument that different kinds of specialists should pool their resources.
Again, that's our role as historians, is to say that no development occurs in isolation. And it's our job partly to say things are complicated, but also to provide some clear narratives through that complexity as well, and perhaps to draw out some of the really useful things that we did learn from those without necessarily having lessons from the past. We can actually draw some substantial conclusions by picking out the key threads from that complexity.
Different crises create different kinds of evidence, different archives, if you like. And depending on when and how things happen, there are different amounts of evidence available. We know a huge amount about COVID for obvious reasons. We know less about the Spanish flu. And we need to infer more because it's less well documented. Can you talk about that problem?
The archives of the Spanish or pneumonic influenza pandemic are particularly intriguing because they're so patchy. Most historians know that a lot of archives often follow money and authority. So governments, churches and the military are great at keeping records usually about certain things like pay or illness or misdemeanours, but also there are often significant gaps in collections of surviving material, particularly when there is a crisis and the normal proceedings break down. One of the things I've done as a historian over my career has been to study crises, partly because you have the fun challenge of trying to fill in some of those gaps and find unusual sources, but also because when there is a crisis, the analysis of that in its moment often also brings out what should happen normally as well. So in a weird way, a tragedy or a crisis can actually help you understand what would have been normally happening in that society, which are often the things that aren't written down as well. In the context of the Spanish flu pandemic, there were certainly quite a few military and medical records. I think some churches kept good records, but others didn't. To give you a classic example, in New South Wales at least, schools were compulsorily closed. So if you go back through school archives, even at a local high school or primary school, you may find that there's just a break in the records from early 1919 until about the middle of that year. That's because the school itself had shut, students weren't allowed to turn up. The male teachers may have been put in charge of an emergency depot, as effectively dragooned into being healthcare workers, and the female teachers may well have been strongly encouraged to act as nurses. They may have left an account of what they did in those settings, but what they didn't do was have any record of how the school operated and how it felt to have students who were absent for months through that period. In that sense, you've got an absence in the archive, which can still be read, but you do need to piece it together by juxtaposing it with other sources as well. I mean, that's one small example. It doesn't mean that schools weren't affected because there's no evidence, but in effect, it's the reverse, that the very absence of archives about school attendance, the health of children, the impact on their families, the impact on their long-term education, the very absence of that is what's meaningful to us as historians, as long as we can see that there's a gap.
I'm really struck by what you say about absences in archives during crisis. We might not find out certain things because records stopped or different kinds of records were kept. On the other hand, we might learn things we otherwise wouldn't know. For example, recruiting women into the workforce teaches us new things about gender attitudes and the economy. But in one sense, COVID is different. Right now, we're swamped in detail. Most of this detail, however, is medical evidence, and I wonder if the very fact that there's so much medical information means that people won't see COVID as a historical event. I think in general we see it as just a disease. That is, COVID's a frightening menace until we develop vaccines and antivirals that save lives. And then we think the problem's finished, medical emergency over, problem solved, revert to normal. That simplistic understanding gets in the way of seeing COVID as the product of other historical conditions, overpopulation and environmental destruction being just two. Would you agree about that, Peter?
By and large, yes. One of the things that struck me early on as COVID was unrolling in those first few months, as I mentioned, I was feeling a sense of familiarity around it. As the media calls started to come in, I had to think very seriously about my ethical stance. Because, of course, I could have taken a really scaremongering approach and talked about the horrendous death rates of epidemics of, say, smallpox, where you're talking about 20 to 30% of people who develop the disease dying. And I thought, well, that would get me lots of media hits, but it would be socially irresponsible and I would think unethical. I did have some positive messages that I could genuinely share as well. And so one of the ones that really came out of my experience of studying the Spanish flu pandemic had been the importance and power of communities, of families, the next door neighbours, the people down the street, even down to the local councils who actually had kept reasonably decent records until they were also sick that their record keeping broke down. So coming into the pandemic in those first few months, I was able to say that, look, thinking about a pandemic that occurred 100 years ago in a society that was profoundly different to our own but was broadly structured in the same way, what it really came down to was caring for each other. It was looking out for the person in the flat next door or the person 2 doors down who appeared to be ill, but also it came down to our personal ethics as well, about not going out if we felt ill, about making sure we wore masks and covered our coughs and those sorts of things. They were all fundamental human behaviours that appeared to have had some impact 100 years ago and were still relevant to how we might react in 2020. So that was certainly one of the things where I felt that we could actually learn from the past a little bit and put it into that historical context.
And that isn't just a generalised historical context. It's the context that could only be provided by a historian who has studied the dynamics of communities as they worked in the past.
One of the things that being a historian observing COVID unrolling drove home to me was that there are still absences in the archives as well. Yes, we certainly did treat it as a medical event. We certainly did have to socially isolate ourselves and buy masks and decide whether or not we wanted to be vaccinated. We had to buy into that biomedical model or not. But there were also many other enablers of how we came through that pandemic that weren't really being observed. And the one that really struck me was the people doing food delivery. The young 20, 21-year-old person on a Deliveroo cycle, keeping a local business going by delivering pizzas to people who said that they were locked down. And of course, they were locked down, but how did the pizza get to their home? And it was by somebody generally on a pretty subsistence wage in the gig economy providing food, so connecting money and supplies with businesses to people who actually needed to eat. In a sense, those people weren't isolated. They were putting themselves at high risk for probably a relatively low income. Now, will we have any records of their deliveries 50 or 100 years from now? Probably not. It all went through an app. There'll be a lot of metadata around that, and you could actually track who delivered what, where, and for how much they were paid. But will that data ever be archived? Will we ever be able to access it again historically? So my feeling was that if we were ever to erect a statue to the COVID pandemic, it should be a young person in a raincoat on a bicycle with a pizza delivery box on the back, because they were the sorts of people who were keeping our society moving at the midst of a crisis, and yet who will probably easily become invisible to history even 5 years from now.
Two thoughts occur to me here, Peter. The first is that in studying the outbreak of plague in 1630 in early modern Florence, I actually did uncover the written records of a group of lay Christians who went from door to door, helping the poor in their homes. I can actually tell you in what direction they walked, where they turned corners, whose houses they visited. It's just like the Deliveroo case, except that because the evidence was recorded on paper and not in an app, it survived. And that epidemic told us not just about the disease, but about Florentine community and Christian charity. A second thought is that I love your suggestion of a statue to the unknown Deliveroo driver. I think that's genuinely a beautiful idea. I've read an article about the increased politicization of young people, in part because of COVID, because of the experiences which they went through, and the increasing feelings of marginalization they had. One way of ensuring that people do know about this in another 100 years is for historians to study it now, while there's some record of these kinds of things. Another thought is that the diverse ways in which different levels of society suffered from COVID in Australia in July 2020 have a lot to tell us. If you lived in Melbourne, you know about this particularly keenly, but the whole country will remember that 9 high-rise social housing apartment towers were put into a hard lockdown without warning by the state government there, and the residents were not allowed to leave for 5 days for any reason. They hadn't been warned of this beforehand. Many didn't even have enough food. Many didn't have vital medications, and it was really quite a scandal. And it's the kind of thing that tends not to have happened to more well-heeled members of society who don't live in social housing. So there are opportunities there to study the way a society deals with a crisis based on how much money one has, how much education, what one's background and networks are. And there's also, of course, the neighbourhood culture that you referred to, which has brought much more into prominence. And for quite some time in 2020 and 2021, that seemed like a positive way forward. Maybe it'll still happen. One of the subjects of today's conversation is the many varieties of expertise. Now, we all respect expertise. You, I, and the overwhelming majority of our listeners want our doctors and medical researchers to have formal scientific training. I certainly don't want to be treated by an amateur doctor. What about history, though? Academic historians go through specialist training as rigorous as that done by medical students. But do you think that everybody needs to get a PhD before they can enjoy or perhaps even practice history?
I loved history my whole life, but I didn't actually study it formally until I was really in my late 30s and certainly really seriously in my 40s. And that's led me to have a definition of a historian, which is someone who uses materials from the past to explain what it was like. That to me is a historian. It's the fundamental aspect of what we do, whether or not we're academically trained, whether or not we are paid or not paid to do that. And that people more broadly feel empowered and encouraged to study history to the level where they feel comfortable with their output, and that they feel that they belong to an inclusive community of people who welcome them in studying the past. And certainly my role, both working in a museum but also as a public historian, is to encourage people to get in and have a go, to engage with those materials from the past, but also to apply that rigour of explanation. And I tend to describe the process of becoming a historian in 3 steps. The first one is, look what I found. That joy of finding something from the past, whether it's an object you found in an antique shop or an archival document the first time that you've gone and looked in a formal collection. The second stage is, here's what happened. In other words, a chronology. Well, look, I've managed to put this sequence of events in order, and isn't that exciting? It certainly is. But to me, the real challenge of being a historian is the third phase is, here's what was going on. And that's where it comes down to context and interpretation. And there's sort of an iterative process. You start with finding something, you put it into a sequence. And what I encourage anybody who loves history to do is to go to that third stage and think about, well, what does this all add up to?
There's a really highly interactive dimension to what you do. It strikes me that one could add a 4th point to the 3 you've already mentioned. And that 4th point might be the confidence to write down one's impressions of what's going on, so people, let's call them citizen historians, can contribute to the archive. And they can do that by letter writing, by keeping a diary, or by writing up a personal history. You don't need to enter the academy to do any of these things in a way. And I'm really not joking. All this reminds me of the ABC's great program Gardening Australia. Gardening Australia has been running in its current form since 1990. It's a deceptively simple masterpiece, conceived and run by experts, but which celebrates and promotes amateur enthusiasts whose expertise often matches that of the host. It opens up endless different ways of looking at the environment and people's relation to it. And I think you're describing something similar, Peter. Do you think the comparison works?
Gardening Australia is an example of how expertise comes in many forms, and it can be shared generously and collaboratively and with respect, and also with acknowledgement that there are different forms of knowledge. Some of them are applied knowledge, some of them are a lifetime of accumulated experience, others are we might have called book learning, and they can actually all interact in positive and productive ways with a smile on your face as well. A couple of weeks ago, I was at an academic history conference, and one of the presenters there was an expert on land records. He does have a PhD in history, but he spent 40 years looking at land title, land transfer, maps, all sorts of things along those lines. And he was giving examples of how you can read extraordinary detail into the society that created those, from Aboriginal disenfranchisement and breaking that link with country, through to the presence of Chinese market gardeners in a particular context, and then their movement out as an area gentrifies. You can read a lot of that in land records. And he said he's given talks to genealogists, to other groups of family historians, to local historians, to professional historians, to heritage practitioners. But the one group who's never called upon him to make real sense and get value out of those records is academic historians. He's actually a hero of mine. He's so generous. He's a wonderful colleague. I really respect his deep knowledge and the way he shares it. And he was actually issuing a generous call. He wasn't berating academics for not coming to him. He was saying, I'm still willing to do that. Coming back to your analogy, it's very similar in the sense with Gardening Australia too. There are so many ways of knowing, and they can be complementary and additive rather than competitive.
I could not agree more, Peter. And here I can put in a plug for the History Department at Sydney University, where Professor Mike McDonnell has for years run a unit called History Beyond the Classroom, which allows students to see the discipline as a practice that they can integrate into their lives. Probably the most important thing is just to encourage people to keep on asking questions.
And the questions are what animate all of us, Nick. Every archival document you find prompts more questions. And every time you think you've set up a structure to explain why something was the way it was in the past, or why people believed certain things or acted in particular ways, it's not to make it like a scientific discovery process, but to say that good history provides evidence, it provides a comprehensive way of thinking about the society that you're understanding, but it also leaves you wanting to do more. And that's what I really enjoy doing with my histories, is encouraging other people to think, oh, well, there's a gap there that I could fill in, or there's a different way of looking at that I could pursue if I find a different set of sources as well. And to give you an example, just in the last week, I wrote up the story of an aircraft accident in Sydney in the early 1970s, and I was developing that through conversations with air traffic controllers and aviation journalists. And I sent them the draft that I wrote a week or so after we had a chat. And one of them wrote back to me. He was a very well-renowned air traffic controller. He'd been very powerful in that area. And he wrote back and said, wow, okay, there was obviously a lot of things that we didn't understand at the time as we were going through them that you've laid out in your story. And of course, I felt quite proud about that. But I wrote back to him and said, well, look, that's one historian's take on how those events panned out. But if you look at the sources in a different way, you'll have your own interpretation of those as well. And I really wanted to make sure that he didn't feel like I had written the history of that incident, but rather I'd used a collection of sources to write one history of that event. And I really wanted him to come to it and think about how he might tell that story from a different perspective.
Always more questions. And that's now my personal problem, because I have 100 more questions that I could ask you, Peter. That is kind of the point that you're making. So perhaps this is as good a place as any to round our conversation off, or at least that part of it that is happening in front of a microphone. I hope that people listening have found your ideas and the generosity of your philosophy about what it means to be a historian as inspiring and tantalizing as I do. Thank you so much for coming in to talk to me today.
Well, look, Nick, it was a delight to talk to you. And I mentioned heroes before. You are definitely one of my intellectual heroes because of the generosity and the genuine inspiration I saw in the students that you taught in your many years at the University of Sydney. So it has been a genuine privilege and a pleasure to chat to you today.
Thank you so very much, Peter. We acknowledge the elders past and present of the Wurundjeri people of the Kulin Nation and of the Gadigal people of the Eora Nation, traditional owners of the lands on which this episode of Making Sense of History was recorded. The podcast was produced by Peter Adams from the University of Sydney School of Humanities.